presentation, and I believe from the very first slide it is very clear that this medical certification of cause of death has got a very much of importance. Statistics govern. It is very much obvious from the very first slide that if you look at this slide, it is under Ministry of Home Affairs and one of the most important ministry of India. Now it says that what are the obligations, what are the responsibilities of us as a medical doctors. So we will be discussing that. Have a look at this second slide. It is 24 June 2014 Times of India report. It says that most states skip certification or death certification issuing of cause of death. If you look at this data, it is very obvious that of the 48.1 lakh death registered in 2010 across country, cause of death was recorded in just 20.2% of cases. How it affects us means as a doctor, how it matters to us. Let's have a look. First of all, have a look on the contribution of different states to this MCCD or medical certification of cause of death. If you look at this and if you look at the country map, it will be very clear that these are the only states which are providing data or medical certification of cause of death. So as per this report of Times of India, that total deaths registered in country in 2010 were 48 lakh. Out of that, only cause of death registered in 9.7 lakh cases only. These are the contribution. I'll show you another slide which make it very clear more, and that is Goa has got the highest contribution. Every death in Goa is registered or medical certification of cause of death is issued in that state or union territory. It is followed by Union Territory of Puducherry, followed by Maharashtra and Karnataka. But most of these states in India, they fall in this category where there is just 20% MCCD coverage is there. And unfortunately, few states like Uttar Pradesh, they have stopped sending any data to Government of India after 2008. We agree that fortunately Rajasthan is not among those states which are not sending any data to Government of India, but we are not in a very good condition also. Rajasthan has got only 10% of contribution in sending MCCD data to Government of India. Now the question arises, these are all figures, how does it affect us? Or means how does we as a doctor are concerned with all these things? Have a look on this report. This report is again sent by Registrar, Office of Registrar in 2010, and it says that because of that MCCD certification, the leading cause group of death which came out to be circulatory system 29.8%, disease of respiratory system 9.5%, other abnormal clinical finding 12.5%, and these are the percentage of share of causes which are related to death. Now when this report was published, there was much debate amongst the doctor itself, because we know that when we talk about daily or disability adjusting life years, respiratory diseases contribute the most. But in this list, circulatory system was that which was causing 29.8%. Now one can understand that the causes which were shown in this were because of incomplete certification. You can get this thing very easily, that it is because of 20% contribution, because we don't know. Actually in most of the deaths, the cause of death is not intimated to Government of India. So whatever data is published, this data is published because of that 20% data only. So now with this background, I would like to start this what MCCD says, what MCCD or medical certification of cause of death stands for. So if you look at MCCD, it was in 1961 that there was a conference organized by WHO for the countries for across world for improvement in vital statistics. And it was in 1969 in India, Registration of Birth and Death Act was enacted. So we call it as RBD Act. And in 1969, there was the applicability of MCCD. So that means MCCD or medical certification of cause of death is in picture since 1969. So more than 40 years. Now what does it say? It says the mortality statistics, it is an integral part. It is the basic component of population growth, and it is one of an indicator which is, or one of the data set which is giving us this cause specific mortality rates, which is a very important key indicator. The entire MCCD or medical certification of cause of death, we can say in another way, is a scientific basis by system of medical certification. Is there a natural need? Though we have already discussed, just to stress upon again, how we as a community medicine or public health persons are affected with all these, or public health as a whole is affected with this certification. When data is incomplete, we cannot assess the effectiveness of public health programs as a whole. This is a very important way, or this MCCD is a very important way of providing an effective feedback, and it is essential for better health planning and management. Whenever we are going for our research proposals in ICMR, and we have to choose a topic, the most important thing or the easiest thing which we do is that we look for the priority areas or the thrust areas which are given by ICMR. So where from this list come? This list actually comes from all these MCCD causes. MCCD actually tells us that what are the contribution of different factors for deaths, or what are the thrust areas or the priority areas for public health programs. So priorities of health and medical research program is actually obtained with this MCCD data. So if I put it in three important bullet points, I will say that the importance of death certification will be in legal uses, in administrative purposes and statistical uses. And legal uses, we all know, legacy issues are very important issues in every family after death. So this MCCD provide that legal use, because we all know that when it comes to the insurance, suicides, they forgive the claim of insurance for the deceased or the bereaved family. Administrative uses for the safety or accident prevention, and statistical uses, as I have already mentioned, for the research purposes. Now, what are the registration where it should be done or where it is usually done? Place. The registration of MCCD or medical certification of cause of death is usually at the place of occurrence, that means in our hospitals, and in the office of registrar of births and deaths. We call it as registrar of vital events. And the death information which is sent to government is through these four certificates. One is MCCD, medical certification of cause of death. We have to remember these form numbers. Form 4, 48 is a uniform thing across country. Death report, which is form 2. Stillbirth report for pediatrics department, very important, it is form 3. And death certificate, form 6. So we'll be discussing few of them at length. Now, what is our responsibility as a doctor? If you look at our responsibility as a doctor, physician has a responsibility of these three things. We have to diagnose death, we have to pronounce this death to the relatives or breaking death news, and we have to fill up form 4 and form 2. So I will cover actually these two important points, form 4 and form 2, which is very important and a legal obligation for all of us. Now, the basis of classification and coding and grouping is based on World Health Organization classification of diseases, which we call as ICD-10. 10 stands for 10th revision, and ICD stands, we all know that, International Classification of Disease. Now, this ICD-10 actually is a vast topic, and at some point of time we'll again discuss what is ICD-10. But for now, ICD-10 has got 22 chapters. Previously it was having just 21 chapters, and after SARS, 22nd chapter is also added. Now, what is Broderick Committee recommendation? Broderick Committee recommendation says that MCCD certificate can only be issued by that doctor who has at least once examined the patient during the 7 days preceding death. So it is very clear, it should be very clear to all of us that even as a unit head, if unit head is on leave and he has not examined that patient, he or she cannot issue MCCD certificate if he has not or she has not examined it even once in 7 days. So it can be issued by the senior resident or the consultant who is at the time was consulting or was at the time giving services to the patient. According to RBD Act, RBD means Registration of Birth and Death Act, doctors should issue certificate so that no delay should occur. Now, MCCD or Medical Certification of Cause of Death is under section 10.2 and 10.3 of Registration Act, and it is under section 23.3 of RBD Act. So we have to keep these things in mind. We have our medical legal experts with us. We have discussed it with Dr. Puneet also. that these two sections, they must be remembered to most of us, and that's very important. I'll tell you why. The most important thing in this MCCD certificate is confidentiality. So that means MCCD certificate or medical certification of cause of death certificate is a confidential document. It cannot be made public. Now what actually we follow in MCCD certificate? MCCD certificate or cause of death certificate is in two forms. One is form number 4 and the other one is form number 4A. We are not concerned with form number 4A because it is usually meant for non-institutional deaths. That means if death occurred in home and we have been asked to certify that if the patient is dead or not. But we at All India Institute of Medical Sciences, Jodhpur, are concerned with form number 4 because this is that form which we have to fill up. Now this certificate is to be sent to local registrar of births and deaths, municipal corporation, or in Jodhpur we call it Nigam, by 5th of that month. But we should make it very clear that this is the maximum. By 5th of that month doesn't mean that we have to wait for these certificates that the 5th of that month should be there and then we should send it. No, it is the maximum limit. By 5th of that month, the MCCD certificate should be sent to local registrar. And then from the local registrar, by 10th of that month, this certificate reaches Chief Registrar Delhi. Now this is the pro forma which we are filling in All India Institute of Medical Sciences. This is the same which we have adopted from WHO. If you look at this, this is form number 4, medical certification of cause of death. And here it is written very clearly, it is to be sent to registrar along with form number 2. So that means we as doctors in All India Institute of Medical Sciences, we are needed to fill two forms. Number 1 form is form 4 and number 2 form is form 2. Now these are the particulars, we will be discussing them, and the most important things in these two things are immediate cause and antecedent cause. Now this is that manner of death which is again to be filled very clearly. Below this form there is a detachable portion. This detachable portion of form 4 is to be given to the relatives of deceased or bereaved family. Now if you can have a look on this on the language which is written over here, you will find that there is no cause of death mentioned here. So it is to be kept very clearly in our mind that the slip which we call in local language as death slip is to be given to patient having no mention of cause of death. As I have said earlier also, it is a confidential document not to be disclosed even to the bereaved family when he or she is living our hospital premises with the dead body. You can understand the purpose of giving this detachable part to the patient's family is because he has to perform the last rites of the deceased or dead patient, or he has to cross our security system also, because police or the security guards who are standing outside the premises of All India Institute, they will examine that whether the patient's family is having this death slip with them or not. Now let's have a look on form 4. Form 4 is having two parts, one is the immediate cause and the other one is the antecedent cause. As the name itself suggests, immediate cause gives an idea about the disease, injury or complication which cause death. So it is an immediate cause. Now it is written very important that mode of dying is not to be mentioned here. It is cause of death. So words like heart failure, or if we mention cardiorespiratory embarrassment or cardiac failure, they are not allowed, or it will lead to the major error in the filling of forms. Antecedent causes are those morbid conditions, if any, which is giving rise to the above written condition. Part 2 is very important also. In part 2 we mention other significant conditions. These significant conditions are those which cannot be put into part 1, but they in a way contribute to the cause of death. We will come to some of the case studies. Now the manner of death, as I told earlier, is very important. We have to circle. One thing which is also very clear, we have not to put right or wrong sign over here. Anything which we found should be made circle. So encircle the cause. Interval between onset and death approximation is also very important. So this part also must not be kept vacant. So if we say a properly completed certificate will show underlying cause on the lowest used line of part 1 and then the immediate cause on part 1. So causal order of sequence will be ascending, or you can say that we have to fill this form from down upwards. The condition which occurred earliest will be at the lowermost point. The checkpoint will be, if you look at the duration, 1A is less than 1B is less than 1C. So that is a checkpoint which we always follow, that if 1A crosses 1B crosses 1C, we have filled the certificate in a reverse order. So line B, C and D, they are due to or as a consequence of. So we can say 1A is due to 1B is due to 1C. So that is again, and this due to is not a casual word. Due to apply to etiology, pathology as well as the chronology of events. What if, the second condition, what if the cause of death is surgery? So if due to the cause of death is surgery, we have to mention what condition was being treated, what medical procedure was performed, and what the complication was. Now, as I mentioned, this was about the part 1, which was part 1A, 1B and 1C. In part 2, any other medical condition or any other condition which led to this part 1 is to be mentioned in part 2. Let's have some case studies. In first case study, it's a 60-year-old hypertensive patient who was admitted to surgical casualty, and she was diagnosed with strangulated femoral hernia with bowel perforation. Surgery was done and she developed peritonitis and died 2 days later. So the kind of form which is filled up would be like this. So this is the second significant condition. So that is very important. This is second. It doesn't directly lead to death. The direct cause of death was peritonitis. So it is over here. Strangulated femoral hernia. So peritonitis due to strangulated femoral hernia. And the other condition which would have probably led to, contributed to death, not led to, is hypertension also. So you must have seen over here, because it is by the history which we get from patient. So we have written here unknown, it is 2 weeks and 2 days. So again the same checkpoint, it is 1A less than 1B. We never consider this, 1A, 1B, 1C. 1C was not here, so 1A less than 1B. Have a look on the case study 2. 34-year-old male, 9-month history of unintentional weight loss, Western blot done, HIV positivity was found. Lung biopsy confirmed it to be a case of pneumocystis cardiae pneumonia. Patient was put on pentamidine therapy. Patient was discharged. Again came back with symptoms, did not respond and died 2 weeks later. So the kind of form which we are going to fill up will be like this. So HIV infection over 17 months, because it is very clear over here. We know HIV and AIDS are different entity. HIV is just positivity, AIDS is symptomatology. So here it is written 17 months after the patient was first discovered to be HIV positive. So we go by this. So it is HIV infection over 17 months led to acquired immunodeficiency syndrome or AIDS, which led to pneumocystis cardiae pneumonia 2 weeks, which is the cause of death. Now, a very interesting one, as we all will agree that we do know how to fill it up. What's the matter? What's the big deal? Yes, there is a big deal. Have a look on this case study number 3. A diabetic man who had been under insulin control for many years developed ischemic heart disease and died suddenly from a myocardial infarction. Now, let's have a look what Dr. X filled form as. Dr. X filled this form as like this. Diabetic mellitus, he took it as 1C, or the most important underlying cause, which led to chronic ischemic heart disease 5 years later, which led to myocardial infarction 1 Now, when this form is received by the statistical department of Government of India, what they will do, the lowermost part of this part 1 is considered very important or most important underlying cause. So, what this gentleman will do, he will write diabetes as the underlying cause of death. And as I mentioned in my first slide or 2 slide, now this will contribute to diabetes as underlying cause of death. So if suppose government is going to, plan a public health program, this will be planned for diabetes, because diabetes is the underlying cause. But have a look on what Dr. Y did. Dr. Y was not sure. He said diabetes cannot lead directly to chronic ischemic heart disease. He will say it is just contributed indirectly. So he put part 2 as diabetes mellitus 12 years and part 1 chronic ischemic heart disease and myocardial infarction. Now the entire picture changed. Statistical office would select chronic ischemic heart disease as the underlying cause of death. So now the priority changes. So as I mentioned earlier, though MCCD certificate is a small certificate, but it led to greater implications as public health programmer. So now the program will be made on chronic ischemic heart disease rather diabetes. Now these are the examples of some of the incomplete descriptions of cause of death. This is available online also. We can have a look on one of them. Writing abortion doesn't suffice. We have to mention what kind of abortion it was. Writing arteriosclerosis is not sufficient. We have to mention these things also. So these are some of the important things which we should mention or which we should have in our mind while filling all these forms up. But one can get this idea in our mind that how can we remember those many point of things when we are filling all these forms. Now we can help, we can fill these forms, and if suppose we want to know what abortion we should mention, we should fill it up with the help of one of the software which is available online also, and show that. Now these are some of the type of major errors which doctors are usually making. One of the major errors is mechanism of death. They list, as I told you earlier, like cardiorespiratory embarrassment or cardiac failure. Some of the minor errors are like use of abbreviation or absence of time interval. So there are very many studies which have been published. Now what are the penalties? Or if suppose we did this offense, what government will do? The charges are not very much. It is just 50 rupees charges that will be imposed on the medical superintendent of the hospital. Fails to give information, false information, or refuses to write his name. So doctor has to put his name after his signature because name will be entered in the document. Now this is that online, suppose we want to know the patient died of abortion, what should we write? This is that software, this is that URL which we can type. If we can type, these are those 22 chapters of ICD which are available. We put our things and from here and we'll get the exact code, that code which we should write, or at least that word which statistical department will understand. Now there is a situation, what if there is no attending physician or patient is brought dead? Then in that case, form 4 will not be filled. So it should be kept in mind that if in case patient is brought dead to All India Institute of Medical Sciences, we have not to fill form 4 or 5, but we have to pronounce death. So in that case, form 2 will be filled. Now this, after filling form 2, and this body will be handed over to legal agency like police, or post-mortem examination will be done, and MCCD, actual certificate, or form 4 will be filled by the autopsy surgeon after clearing. Now this is that form 2. It is also available at our institute. So actually, as some of us know that few deaths have, 2 deaths have been there in past in our institute. So form 2 is being filled also. So this is that death report or form 2. It is in 2 copies. One is in legal information which is sent to the office, and the second one is the statistical information which is sent. This is the pro forma of form 3. This is the stillbirth report. Now this is a very interesting thing. This is death certificate of form number 6. For years together, we have been using one term very wrongly in our medical profession. When I was a student, when I was a resident, when I am now faculty over here, we keep on listening doctors calling death certificate. Kindly don't use death certificate for MCCD. Death certificate is form number 6, and we as a doctor are not authorized to issue any death certificate to the deceased. So death certificate or Mrityu Praman Patra is actually, it's a property of Government of India. It is being issued by the Registrar of Vital Event. It is form number 6 and not form number 4. So just have a look what exactly death certificate is. It is based on death information provided by form 2. It is signing authority's registrar and not doctor. It is issued to nearest relative, okay. It is issued following section 10 and 17, not like sections which we have mentioned in form 4. It contains fact of deaths and it is a public document. So there is no confidentiality. As per rule 13, fee is charged. So there are very many differences. We must not get confused with MCCD and death certificate. MCCD is issued after fee is deposited at government office. It is issued by registrar. It is a public document. And contrary to that, MCCD is a document which is issued free of cost. It is a private document and it contains fact of death. This cause of death is not mentioned. So in death certificate, cause of death is not mentioned. This is very important. So let's summarize. This is the last slide. So if we summarize the entire thing, the very first important thing which we would like every one of us should follow is we should call MCCD and not the death certificate, because that gives a wrong terminology. Don't delay for any reason issuing of MCCD certificate. No fees to be charged, we know it very well. No doctor should sign MCCD in advance. That doesn't mean that we are going to sign it in advance, but usually some of the documents are kept with us signing in advance. That if suppose I am on leave, my subordinate can fill it up, but it can be used for some other purpose also. The names of disease should be written in full and legibly. Evidently, line 1 cannot be kept vacant. Abbreviations, please don't use them. The kind of mode of dying must not be mentioned, and due thought should be given to the last entry under 1 as it is picked for statistical purpose. It's not very clear. These kind of certificates where it is written undertaking from the patient that मैंने अपने मरीज का सब सामान और death certificate receive कर लिया है must not be obtained. Even if we want it for our purpose, we should write here MCCD certificate, not the death certificate. So these are the suggested reading, ladies and gentlemen. These are the physician manual on certification of cause of death available online also. This is the module and workbook for New Delhi orientation training on ICD. Thank you.